everybody, welcome back to my channel. My name is Ainel, where I am a on-again, off-again travel registered nurse, but now a full-time nurse practitioner. And I decided to shift gears a little bit. It is the start of the week and I need to replenish, reclean all the things of my home health bag. So I thought I'll do a what's in my nurse practitioner bag, home health, telehealth edition. So today we're gonna, okay, don't judge me, it's messy, okay? But that goes along with with the things that I do, okay? So we in a fast-paced environment, so we gotta have a little mess somewhere. But anyways, without further ado, let's get into it. This is my beautiful bag. This bag came in handy so much. I used to carry a shoulder bag like the Figs wide bag that they have on their website, but I find that it's heavy and it always gets in my way. It hurts my shoulders depending on how much stuff I have up in there, and when I'm at a patient home, I'm putting it on the floor and it's just wide open. So I thought I would invest in a rolling bag, and I'm so glad I did. So this bag has 3 pockets. There's 2 on the side, it's over here, and then 1 in the front, but we'll get to those last. It did come with this strap back here that you can use to carry on your shoulders, but that is defeating the purpose of why I have gotten it, so I will not be using that. So when you open my bag, this is what you will see. Up here I have my mask. These are like little booties for your shoes. I normally don't use those because I do wear Crocs to my patients' homes, and with respect, I just take off my Crocs. It's easy to slide them off. But if I do notice that the home is kind of like, they have pets or it doesn't look as clean as it should be, still with respect, without bringing my shoes in there, I will put the booties on. But 9 times out of 10, they'd be like, oh no, you don't have to do that. You don't have to do that. So if they tell me that I can leave my shoes on, I will. But in the event that I need to just slide my shoes off, I have my Crocs, I just slide them off. Or if it's not sanitary, I will just use my booties right there in the back. These are A1C checks. So you guys know in the hospital or even at home for my diabetic patients, I do have, we do have these, it's called POC, which is point of care, and it's like instantly. So with these, instead of checking your blood sugar for that moment, we will check your hemoglobin A1C. Now, some might argue and say that these aren't accurate, but we did a little testing on ourselves when we did training on those, and I did it on me, and it was really spot on. It was accurate, and for the most people who did it too, they said it was accurate as well. So we do use those, but we do also encourage to get the blood like lab hemoglobin A1C as well. So we only use these if they have not had a hemoglobin A1C done within a year, because even if they're not diabetic, we still would like to know where they are. Usually diabetic patients, we'll check them frequently. So at least 3 months, every 3 months, but if not, at least 3 to 6 months, they should have a hemoglobin A1C if they're diabetic. Okay, so now let's get into the meat, okay, of this bag. So here I have my sharps container. Now, usually I do carry these because we do have to check their hemoglobin A1Cs. So we have like these little lancets, and so I will put them in here and dispose of them properly. And this side over here, I don't know, there you guys go. And this side right here, I have my little nurse bag. Keeps all of my pens. You guys see my little lip balm there because my lips be dry. I do have an extra pair of scissors in here if I need to use it. And then there's like a little doggle. This thing here, and I'll show you guys what this is for a little bit later. But other than that, that's usually what I carry in here. So I just have my pens, my markers, little mirror, okay? Because a girl be getting eyelashes in her eyes, okay? So that's what's in this bag. Other than that, there's nothing. Oh, there's one more thing in this container. Compartment, shall I say. This goes to the little spirometry I'm going to show you guys that I just showed you, the little dongle. This goes with that, and I'll show you guys what this is for. I also have this in the larger part now. This I have bought when I was a home health nurse with another company. Because those patients had a lot of wounds that we would see and address. So this was used to measure their wounds. I would try to get the depth and all of that good stuff. But I don't necessarily use this no more with this job. So I'm going to take this one out. And then in the event, if I do need a ruler, there's these like paper ones that I used to have. I gotta find, I think they're in my other bag, but I'll probably just swap that out, swap this one out for the paper ones, and then those are easy. Once I'm done with it, I can throw it away. So of course we have our alcohol pads. You know, you gotta keep these. You have to keep these because in the event you need to clean something, or go ahead and clean the fingers of your patients when you're doing your A1C checks. Or even sometimes you need to help your patients check their own blood sugars. So, gotta keep these. Right here is the mother, okay? This is my holy grail right here. No, but this is my stethoscope and my pen light. Now, I had a pink pen light, and I think I left that at one of my patients' homes. I'm so sad. But anyway, this is the Echo. Okay, I got it engraved. Nothing like that's going to stop anything. And the reason why I said that is because there was a doctor when I was at the hospital. Why he lost this? Why did he lose this? Not even going to say he lost it, okay? He put it somewhere and someone stole it. So, not like that little engraving is going to stop anybody from stealing this thing, but I keep this with me, okay? Some might argue like this is useless. It is so not. It is so not useless. Now, I have not used it to its whole potential because, you know, I'm just going in their homes. So I don't really need to check EKGs or, you know, keep memory on my phone. So I don't use the whole full potential yet. And I do say yet because your girl is trying to make moves, okay? Okay. But anyways, this is really good. I mean, I can hear everything. Now, when you're in nursing school, they be trying to have you like, oh, see if you can hear a gallop or a click or a murmur. With our standard stethoscopes, you can hear them, but this just amplifies it so much more. So if you're a nurse practitioner, a physician assistant, of course, a physician assistant, or a physician, of course, this is recommended. Like I really do love this one. Now they do have the other one with like the little the fatter piece in the middle here. I have seen cardiologists use those, and so those are just as good. But this, love it down. Okay, but I do carry my manual one, and let me tell you why. So I do carry this one. I carry this one that my sister bought me at Love Down. This was my graduation gift from her. Yeah. So I do carry this one still because my Echo stethoscope, it runs on battery, of course. And one time I did not charge it, so it was dead. So luckily I have my handy dandy, okay? That's the only bad thing about technology. Like everything runs on batteries. Everything, okay? Everything runs on batteries. So I didn't charge it, so I carry this one now with me just in case that one is dead or has a malfunction. And this one does work just as good, but you know, the other one amplifies the sounds, you can hear more clear. But gotta always keep your girl, okay? Gotta keep your day one. Now I do have my handy dandy blood pressure machine. Now, 9 times out of 10, the patients will have their own blood pressure machine and their own blood pressure cuff. And if they have it, I ask them to use that one just so they can feel more comfortable. And I like to see if they're taking their blood pressure correctly. So I will have them say, oh, okay, let me see how you take your blood pressure. And so they will have their own and then I will use it, but I do have mine just in case. And sometimes I like to compare it to see if they're getting the same numbers. Now, now, my job do send you the basic blood pressure cuff and the, okay, I'm going to butcher that word, but the spirometer. I don't, you guys know what I'm talking about, okay? Hold on, let me just grab it for you. Hold on. Okay, so my company did send this one, and this is the word I was trying to say, the spigamomanometer. Okay, listen, please. Okay, so they did send this, and then this is basically the manual blood pressure cuff. Now, these are very good, and they're more accurate, which I agree. And these are more accurate in the sense that if you need a different size cuff, you can change it out. Now, they did send different size cuffs as well because we do have, you know, your elderly population is very thin. So they did send us very small cuffs all the way up to the large cuffs. So this, I would say, is the best way to take a blood pressure, but and then they encourage you to do that. But if you are a new nurse or a nurse who's, I would say, that's been working in the hospital forever, and you're not sure how to use this, you can give false readings. So you can give false readings, and then that's why I don't encourage people to use this one. Although I would say, please learn how to use it. Please learn how to use it, because I do say that these will give the best and the most accurate blood pressures if you know how to use it right. You know what I mean? So like they're encouraging us to use it, which I agree. You know, even myself, I need more practice on it. But being a nurse that was in a hospital since she got out of nursing school, we didn't have to use this one as much. And the training that we did get, come on, the training that we did get in nursing school was like, I swear to you, we had like 1 day of training on this one, and it was like literally for maybe 3 hours max. And then I think it was in a rotation, so it wasn't like we were just focusing on that part of the training for 3 hours. No, we were going to like different sections, learning different things. So these are very good to use once you learn how to use them. So I do encourage all my nursing students to please, if you guys can get your hands on one of these, go ahead and start practicing with them, because they do give you the best blood pressure readings, and you will impress a lot of people, because not a lot of nurses, even your seasoned nurses, has probably been in nursing for 30 years, 20 years, 40 years, 50 years. They don't even know how to use this, okay? Because, you know, you would think they would, because in more settings of like a doctor's office or a clinic, they will use those kinds, especially doctors. So, I mean, to each their own. They do encourage you to use those. I will say, yes, learn how to use them. Even for myself, I do still need practice. So, learning how to use those is best. But for now, I do have my own blood pressure machine that I'm going to continue to use. You just need to find a blood pressure machine too if you're going to go to these people's home, is to get different size cuffs. So I do have different size cuffs that I need to just make sure that it can fit on my machine right here. If not, I will order a machine that goes to those cuffs. So just in case I go to one of my members' homes and their cuffs is too big, I can use the correct one. So if I can find those before we end this video, I will show you guys those as well. All right, let's get back into it. So we have another one of the mouthpiece, but since I only had two, I'm going to stock up more in here. I have my pulse oximeter, which measures the oxygen and the O2 sat. And y'all seen it was purple, okay? I had a pink one and it broke, and I tried to reorder another one. And I think the pink one was sold out at that time, so I just got stuck with purple, okay? You guys know I'm a pink girl. Okay. In here, I have my Band-Aids, which, you know, is for the finger sticks. It's the small ones. But I did put some alcohol pads in here as well, right there, just in case I run out or left my box. But nonetheless, Band-Aids and alcohol pads in here. Got my gloves. Now make sure I got the nitrile gloves, because I swear to you, the amount of people that are allergic to latex, I don't want to have those issues. So yeah, go and get you guys, save some time and get you some nitrile gloves. If you want to be safe, always keep maybe a few latex gloves on the side, but make sure they're separated from these, because you never know, somebody might be allergic to nitro. I don't know. I haven't ran into anybody ever allergic to nitro, but I have ran into latex allergies. So get you some nitro gloves. Now, this little machine thing here, the Easy One Sky, is usually... Okay, so you guys remember in the hospital where you guys had that spirometry, usually when a patient comes back from surgery or have something that's dealing with the lungs or the heart, they have that little spirometry, and it has like the little green ball and their mouthpiece, and you tell them to do it 10 times per hour so their lungs don't collapse, you know, to keep their lungs strong and healthy. And what they usually would do is they would take the mouthpiece, put it in their mouth, and they will inhale as long as they can to try to keep the little green ball in the middle. Well, this is something kind of like that. And what this one does, though, instead of inhaling, they're going to exhale all the air in their lungs out. So you're going to tell them to take a deep breath. And then this little, let me show you how to set it up first. So this little, this is the mouthpiece right here, this part. There should be an arrow. You guys aren't going to be able to see it, but there's an arrow. There we go. It's like a little arrow right here. You guys can't see. But you will slide this in to match the arrow. So you will slide this in this way. So it'll go in like this. And then the mouthpiece will be sticking out. Okay. And you will turn it on here. And then you'll see a flashing blue light, I believe. And that little dongle piece that I showed you guys earlier goes into your computer where the USB ports are. And it will transmit the information from here to the computer. So basically, this part will go in their mouth. You tell them to take a deep breath. And you're going to tell them to blow out all the air that they have in their lungs until they can't blow out anymore. And you want to be careful. You want to assess the patient first. You want to make sure the patient isn't already severely short of breath. You want to make sure they're not dizzy. And you want to make sure that their lungs are essentially clear, meaning they don't have any wheezing in their lungs. You don't hear any fluid in their lungs, because what you will do if they do have those going on, you will exacerbate the symptoms and they can essentially pass out. So you want to check the lungs first. But this will give you an immediate answer if they have any mild, moderate, or severe obstruction, and then you can treat the patient accordingly at that time. Meaning if they need an inhaler, if they need some steroids, or if they need to see a pulmonologist. Usually when I get to moderate and severe, I will go ahead and send that recommendation over to a pulmonologist. If it's mild, they usually already have like an inhaler or they already have some sort of breathing treatments going on. So in that sense, we'll just keep monitoring if the mild isn't inhibiting or interfering with their daily activities of life. Okay, so what else I have in here? So this I had got from the hospital that I use, and it's just an extra pair of scissors and some tweezers. I have not had to use this tweezers, but of course I've used the scissors before. And this is just basically if I need to help them change dressing, or if they have some kind of bandage on them and need taken off, that's what this is for. But I haven't had to use it at this job, but I do just keep it just in case. Now, this I don't usually use, but if I do need to check hearing or if I need to check reflexes, I do have this in here just in case. I also have a measuring tape that I can use too for wounds if I need it, but the paper would be much better. And I haven't had to check anyone's eyes, to see, but if they do ever complain of like visual changes or blurry vision, I do have this on hand just in case. Then it's just an extra set of scissors and another pen light, but I haven't had to use those because I have my own. So this is just here like a just in case situation. But I haven't had to check hearing or anything like that since I've been here at this job. And I, of course, have my hand sanitizer. This, I haven't used it, as you could tell, because I carry my Bath and Body Works with me in my car. So I've been using that one, but I do have this just in case. And then sometimes the patients do ask, do I have sanitizer? But I've been giving them my Bath and Body Works one. And look what I found. I found it, so I didn't lose it at my patient's home. So good, because I was like, I did not want to buy another one, and I wasn't. It works still good. I don't have to change the battery. Perfect. So let's get into the side pockets, because that is all that's in here besides trash. I don't know if y'all can see the trash, but yeah, we'll clean that out. So in the side pockets here, now this is just the spirometry that I told you guys about, how to use it. How the dongle goes into the computer, they blow into the machine, and then it gives you like how to do it and stuff. And then on this side, it just gives you the certificate number. So I keep that with me just in case something happens to it. I can have the certificate number. This is a notepad, just because I need to take notes. The reason I'm turning it this way is because the business information is on the other side. And then in this case, let me make sure it's closed. This is just my business card holder. So I do have like appointment cards in here. So when I make an appointment for a member, I usually write it down and put it on a business card. So in the front pocket here, for now, I just keep, so these are an extra pair of gloves that I had in here that I don't want to throw away. But since they've been out the pack, they're clean gloves, but I just keep them in the front just in case. So I may probably use these for the cleaning that I'm going to do. And then I have, some magnets, but I can't show you guys that because that's for the members, so it has all the business information on there. But I do keep batteries. So I do keep batteries on me because, like I said, everything runs on batteries. My blood pressure machine, I think, used 3 of these AA batteries. And then this pulse oximeter, I believe, used 2 AAA. So I just keep extra batteries in here as well. And then that's it for this part. But as you can see, I don't know if you guys can see these little, let me see. Okay. These little parts here, the reason why I'm pointing that out because it could hold more stuff, but I'm going to show you why I don't put my equipment there. So on this last pocket side, I have the equipment that can go in those little bandage parts I just showed you guys. I don't keep it there because since these are like electronics and sometimes the front of my bag hit things, I don't want to damage or mess up anything. So, but basically I have my ophthalmoscope and otoscope. So this one, you can see both the ear and the eye. But I usually mostly for the ears, not so much the eyes. But then I have the extra earpieces here, and then this is my thermometer. Now this one I do need to change out the battery because I believe it was dying. Oh, maybe it's not. Okay, maybe it's not dying. The other day I used it, it was flashing, so I thought it was dying. But I'm going to leave these out because with replenishing, we need to clean all of our equipment. So now, let's put these on and get to cleaning. So I have my handy dandy wipes here. If you know, you know. Okay. So let's start with the inside of the bag. Let's get this trash out. And it looks like there's a straggler. So the first thing we're going to do is clean the inside. And then what you guys did not see me show you guys earlier were these gauze. So these are just your standard 2x2 gauze that I keep in here because, you know, when we poke their finger, of course, we need something to wipe the first set of blood off with. So, and you never know when you're going to need gauze. So the reason why you guys didn't see me show you guys the first place because I didn't have any more. So we're replenishing it. So that is everything. I might move some stuff around. Usually, yeah, I might move some stuff around because this one, I can put these actually over here. But that is it. That is everything that you will see in a home health nurse practitioner bag. Now, depending on your specialty, things will be much more different. I'm debating if almost forgot the band-aids. Almost forgot the band-aids. Let's wipe this down. Okay, wipe that down. I'm debating if I want to put these insulin syringes in here. I did buy them before because at my previous home health job, there was a lot of members who needed help with insulin. And so I brought these along to help them learn how to use insulin, how to draw it up themselves. Instead of them using theirs and wasting it, I will have my own on hand. With this job, I have not yet had to help a member do that. But I'm thinking I'm gonna just go ahead and put them in here just in case because you never know. So I might just keep a couple. It's because it's gonna be that time when somebody's gonna be like, oh, can you help me? Because there are a lot of members who are newly diabetic and who have hemoglobin A1Cs of 12 and 13. And they just have been going on with their normal daily life, not even knowing that their sugars was high until they went into the hospital with some crazy symptoms. So I'm going to just keep a couple in my bag for a just in case. And I think I'm going to keep it here in the front. So yeah, that is it. And then we're going to clean the outside. So that is basically it. That is my what's in my nurse practitioner home health bag. Alright, so that's basically it for a what's in my nurse practitioner home health bag, home health edition. Hopefully we can do more of these as things go along. I'm sure there's gonna be things I add, subtract from it as I go along. But there are some things that's coming up that I might not even need that bag anymore, but we will see. But for now, I hope you guys enjoyed that little snippet. And then according to your role as a nurse practitioner, of course, my bag will look different from a nurse practitioner who is a wound care nurse practitioner. So their bag will look different. It will look different from a pediatric home health nurse. So it all depends on your job, what they allow you to do, and then it all your specialty. So my specialty is mostly geriatrics, mostly adults. We tend to try to see patients 18 and over, but at this specific job, we don't get them that young. I think the youngest I've had was maybe 57, and the oldest I've had was 102. So um, it varies. I would say the median age range is usually like 80 years old. So our members are usually older, they don't require much, although they need much, but they're like, let me just live my life. Like, leave me alone. Like, why are you people coming? So your bag will look different from whatever setting or specialty you're in. But if you guys have any questions, if you guys seen something you would like to know where I got it from, feel free to comment, leave a comment below, and I'll get it to you guys. But other than that, thank you for watching, and until the next time, bye.